in this video, we want to look at the lab diagnosis of influenza virus, correct? So, you already have seen in the last video the pathogenesis, clinical features, and what else you saw? We saw the epidemiology, clinical features, treatment, prophylaxis, influenza virus, the morphology, differences between orthomyxovirus and paramyxovirus. We saw the morphology, then we saw the antigenic subtypes, the antigenic variation, very, very important. Right? Antigenic subtypes, do you remember? H1 to H16 and N1 to N9. Human importance are H1, H2, H3, H5, N1 and N2. This much you should know. Okay, right? All this we have already seen. Then antigenic variation by antigenic drift and antigenic shift, we have seen that. Then we have seen the pathogenesis. We saw the transmission, that entry into the target cell. They multiply inside the target cell and then they spread, they do local damage. There is secondary bacterial invasion. There are some complications like COPD, exacerbation of chronic bronchitis, asthma, Ray's syndrome. Right, all this we have seen. Then we have seen the host immunity, how our body reacts and how it tries to protect us. This term, original antigenic sin, is a very unique term. So let us make a nice word art. So original antigenic sin. Remember, original antigenic sin is in influenza. Okay. Moving on. Lab diagnosis. So this is the most important part of this video, lab diagnosis. So we want to diagnose that a person is actually having the influenza virus. So what specimen they will collect? See, majorly it is affecting what? The upper respiratory tract. So you can collect the nasopharyngeal swab and you keep it at 4 degrees centigrade. So something that's new here. 4 degrees centigrade you have to keep. Nasopharyngeal swab. Then you isolate the virus. Some more details on specimen collection actually here. Basically, you can collect the nasopharyngeal swab, nasal aspirate, or even throat swab. Now, swabs, what you should do, you should take a synthetic tip, you should take a sterile synthetic tip. This is the best for collection of the specimen. Cotton swabs are not satisfactory. You should use with synthetic swab. Nasopharyngeal swab, you have to use with synthetic tip it should be, okay, not cotton. These swabs, you should keep them in viral transport media and you should keep them at 4 degrees centigrade during transport, okay, and thereafter you should keep them at minus 70 degrees centigrade. Oh my God. Now let us move on to the second step here, isolation of the virus. Now how will you isolate the virus? Now you will use embryonated eggs, okay, primary monkey kidney cell lines, etc. for isolation of influenza virus. So the amniotic cavity of the egg is preferred site of inoculation. Okay, you should remember this, where amniotic cavity you will use for influenza virus. Okay, for all 3 types of influenza virus you will use amniotic cavity. Is it easy for you? So this is the allantoic fluid. This supports only influenza A. So it is better to put it in amniotic fluid. Amniotic fluid will support all the 3 types of influenza A, B and C. So remember amniotic fluid, okay. Practice this diagram. This is also important for the exam, okay. Influenza amniotic fluid. And then you have the primary monkey kidney cell lines. Now, detection of viral growth. Now, once you have inoculated, then how will you detect that the virus actually has grown, and that is, how do you know it is influenza virus, right? So, you have 2 tests for this. You have the heme adsorption test, okay, heme adsorption test, and then you have the heme agglutination test. First of all, the heme adsorption test let us look at. See, what will happen the infected cell lines, okay, onto that surface, the RBCs will get adsorbed, okay. So, because this virus has this HA antigen, right? Because virus has HA antigen to which RBC will get adsorbed, okay. So, this will happen in 3 to 5 days of inoculation. Then moving on to heme agglutination test. Here what happens, you can detect the HA antigens again. So you will inoculate by adding fowl and guinea pig RBCs. So type A virus will agglutinate guinea pig RBC. Type B will agglutinate both guinea pig and fowl RBCs, and type C will agglutinate fowl RBCs at 4 degrees centigrade. So what exactly you are going to add? You are going to add the guinea pig RBC and fowl RBC. What is fowl? Bird, right? So you will add the pig and not the pig. Guinea pig is actually a rodent. Okay, it's not a pig. Guinea pig and fowl RBCs you will add. A will agglutinate the guinea pig RBC. B will agglutinate both. See, B for both RBCs it will agglutinate, and type C will agglutinate the bird fowl RBC at 4 degrees centigrade. Now, is this clear? How many people are sleeping? Guys, we are looking at the lab diagnosis of influenza virus. Currently, we have inoculated it into the amniotic cavity or the amniotic fluid of the egg, and we have also inoculated it in the primary monkey kidney cell line. Now, we want to detect that the virus. So, we are going to detect the viral antigen, that is the HA antigen, by heme agglutination and heme adsorption. Heme adsorption, we saw RBCs will get adsorbed. Heme agglutination will happen 5 to 7 days. This will take, okay. This will take 5 to 7 days. Here you can see that type A virus will agglutinate guinea pig RBC. Type B will agglutinate both guinea pig and fowl RBC. Type C will agglutinate fowl RBC. One thing you should know here, amniotic cavity is suitable for all the 3 influenza. However, the allantoic cavity is suitable only for influenza A. Okay. Amniotic cavity you can use for all. For all influenza. A, B and C. So, allantoic cavity if you use, it supports only influenza A. Now, we are done with growth detection, right? So, let us see where exactly we are. Let's take a status check. We are looking at lab diagnosis. We have finished the specimen, isolation of virus and growth detection. Now, we can continue with viral antigen detection. We have already seen the growth detection by detecting actually the HA antigen itself. Now, viral antigen detection, molecular method serology will continue. So, let us look at lab diagnosis continued. So, we are looking at the continuation of the lab diagnosis, viral antigens detection by the direct immunofluorescence test. Here what happens, the viral antigens, okay, they are coated onto epithelial cells and they can directly be detected in nasal aspirates by using fluorescent tagged antibodies. Basically, you just take the nasal aspirate, you put fluorescent tagged antibodies, they will directly detect this viral antigen. How? Because the viral antigens are there on the epithelial cells which are there in the nasal aspirate, that's all. It's not very clear for you. Viral antigens in epithelial cells in nasal aspirate. Okay, fluorescent tagged antibodies. This is what they'll be looking for, the word. Fluorescent tagged antibodies in direct immunofluorescence test. DIFT, is it? How do they call this? IFT. Okay, moving on to molecular methods. Here you have reverse transcriptase polymerase chain reaction, RT-PCR. Okay, reverse transcriptase. What happened? Reverse transcriptase PCR. Okay, this detects the viral RNA. This detects viral RNA. Then you have the real-time reverse transcriptase PCR. This quantifies viral RNA. Okay, so much to read. Take a break, take a deep breath. Okay, so we're looking at what now? Molecular methods, reverse transcriptase polymerase chain reaction, and real-time reverse transcriptase polymerase chain reaction. The first one detects the viral RNA. The second one quantifies viral RNA. So you can say how much amount of viral RNA is present. Okay. So this one, reverse transcriptase PCR, is the most specific. It's the most specific rapid test. Okay. Rapid method for influenza diagnosis. It is specific. It is sensitive. Actually, it is most sensitive. They're saying most sensitive, specific, and rapid. Okay. It is also used to type and subtype specific, you can also type and subtype, because you are detecting specific HA and NA genes. So you are detecting what? Specific HA and NA genes itself you are detecting, not the antigen, the genes itself you are detecting. So this is rapid, and it can be used for typing, right? Because you are able to detect the exact genes. The most specific reverse transcriptase PCR is the best. That's what we understand now. Coming to real-time reverse transcriptase PCR, this can be used to quantitate the viral load. Okay, so you can know the viral load. So here it has been designed to diagnose avian flu and swine flu. So you can detect better for avian flu, etc. So if they ask you avian flu, how you will detect, you can write this real-time reverse transcriptase PCR. Just remember, guys, reverse transcriptase PCR, have you seen so far anywhere? No, I have heard of real-time PCR a lot, but reverse transcriptase PCR, and though it is not HIV or some reverse transcriptase retrovirus, here in influenza, strangely, you have reverse transcriptase PCR. So say reverse transcriptase PCR. Reverse transcriptase PCR is an influenza virus detection molecular method, reverse transcriptase PCR, that is RT-PCR. Very good. Moving on to serology, here you will detect antibody, that's why it is called serology. Antibody detection is serology. The antibodies will be detected in the serum. You have 3 tests here: HAI, heme agglutination inhibition test, neutralization test, and ELISA mentioned in the textbook. So note here, in the serum you are detecting, so in the specimen collection, let's add serum also, okay, not just nasopharyngeal swab, throat swab, nasal aspirate, etc. Add of serum also, okay. Now here what you will do, you will detect the antibody by using the antigen, right? You have the influenza antigen, specific influenza antigens you have. Then you will see a rise in the antibody titer, okay. So let us move on to the specific test, HAI, heme agglutination inhibition test. Now look at this diagram if you are able to understand. See, normally there is blood, right, RBCs. Now in our RBCs, if virus are there, what will happen? The RBCs will get agglutinated because of HA antigen, right? Heme agglutination will take place. There is MAT, it will be MAT. Now in case there are antibodies present in the body, right? So now this is a person whose body has antibodies. So you are going to detect these antibodies. How? Because in this case, whenever you are mixing RBCs, antiviral antibodies and the virus and the antiviral antibodies, they combine and the RBCs are left alone. So there you will have button formation. When the RBCs are left alone and there is no agglutination, button formation happens. Button formation means there is no agglutination, remember. So this is the whole concept. So let us look at HAI, heme agglutination inhibition test. Okay. So in heme agglutination inhibition test, serially diluted patient's serum. Okay, you're taking the patient's serum, which is incubated with influenza antigen and RBCs in a microtiter plate. So you have a plate which has a lot of holes, correct? In that plate you will add what? You will add the patient's serum and you will add the influenza antigen. Correct? Then you will add the RBC and you will add the RBC. In case the antibodies are present, then there will be button formation because the RBCs will be left free. But if the antibodies are absent in the patient's serum, then there is mat formation. Okay, just listen, we will read it out for you. Hemagglutination will be inhibited. Hemagglutination will be inhibited if the antibody is present in the patient's sera against which the antigen is added. Okay, so correct antigen is important for this test to be positive. Now, if the antibodies are absent, then you can have MAT. There will be no button formation. Before performing this test, you should destroy the mucoprotein present in the sera. Is this clear? Hemagglutination test is clear, right? Shall we move on to neutralization test? Neutralization test is most specific. They are saying there, they told which one was most sensitive or something. Go back here. Most sensitive was reverse transcriptase PCR. Neutralization test is most specific. Okay. Here you can find out if it is the person is susceptible to infection, but this is very difficult to perform. Okay. Then you have ELISA. It is sensitive, more sensitive than other assays. So in this serology, ELISA is more sensitive. Okay. In ELISA, let's leave this. This is not used, it seems much. ELISA is more sensitive. RT-PCR is more sensitive. ELISA is more sensitive than other assays. So these are all assays. Right? What we are doing here, assay. What is assay full form? Means here you are detecting the content. Assay means detect content. Okay, here you are trying to detect the antibodies in the patient's serum. So in that, ELISA is more sensitive. So now let us wind up this video. Or wait, one more topic is there, right? Last topic is prophylaxis. See, prophylaxis, there is vaccine called as flu vaccine, influenza vaccine, but many people like, this is new and many people take it. It's called as a flu shot. I took a flu shot. It doesn't cover you against everything, but yeah, some things it covers. It is trivalent. Trivalent means what? One or two type A virus. One or two type A virus and one type B influenza virus. So that is what they mean by trivalent. Okay. Then you have, it is given intramuscularly, subcutaneously. You also have an intranasal spray. Very interesting, right? Remember, the HIV vaccination is against the Haemophilus influenza bacteria. That is not going to cover against influenza because Haemophilus influenza does not cause influenza. That is a bacteria that causes meningitis that was incorrectly named. The actual influenza is caused by influenza virus. So that's all we have wanted to cover. So we have finished the influenza completely. Let's just revise the lab diagnosis. Lab diagnosis, you will collect nasopharyngeal swab, serum, and you can also collect nasal aspirate. You can also take throat swab, THROAT, throat swab. You can collect nasal aspirate. Remember to take a synthetic tip, not cotton. Okay. And you should keep it at 44 degrees centigrade for transport. You can also collect serum. Then isolation of the virus, you will put it in embryonated egg. You will use the amniotic cavity because it is suitable for all the 3 genomes of influenza virus. And you can also use primary monkey kidney cell lines. Okay, embryonated egg. If you draw this diagram, you will get good marks. This one. Okay. And show the amniotic fluid around the embryo. That is where you will inoculate. Then how will you detect the growth? By heme adsorption test and heme agglutination test. Both are almost similar only. Okay, the RBCs are adsorbed, that is 3 to 5 days. After that, 5 to 7 days, heme agglutination, they are saying. They are adding what RBCs? They are adding guinea pig RBCs and fowl RBCs. Type B will agglutinate both. Correct? No? Now moving on. Continued, we still have to detect the viral antigen by direct immunofluorescence test. Nothing, you just put some fluorescent tagged antibodies and you will be directly able to detect the viral antigens. Molecular methods, you have reverse transcriptase, PCR is the most sensitive. Then in serology, you have ELISA, which is more sensitive than other assays. In assays, ELISA is more sensitive. Okay. Coming to serology, you have heme agglutination inhibition test. You have to draw this diagram. If antibodies are absent, MAT. If antibodies are present, RBCs are free, they won't agglutinate button formation. Okay, please go that side. Then we saw neutralization test is the most specific but difficult to perform, they are saying. In heme agglutination test, where was it rising titer and all that? Rising titer here, same thing, serology only, rising titer, etc. Rising titer. Rising titer is important word. Then ELISA is more sensitive than other assays. So that completes the lab diagnosis. Let's move on. Prophylaxis, you saw that is flu vaccine. It is trivalent. You have intramuscular, subcutaneous and also nasal spray itself. Wow. So the live one is nasal spray, intranasal spray. Inactivated one is intramuscular and subcutaneous. Take whatever you feel like taking. If you think it is safe, check on the adverse effects, everything, and then decide on taking a flu shot if you like it. That's all for now from our side. Bye bye.